Today, we're going to dive into the body's incredible electrical network to understand what happens when one of its wires gets snipped. We're talking about peripheral nerve injuries, and we're going to follow the entire journey from the moment of damage all the way through the body's amazing process of repair.
I mean, who hasn't, right? You knock your elbow just right and zing! That bizarre, shocking, tingling feeling that zaps down your arm? Well, that's not your bone at all. That's your ulnar nerve getting briefly squished and sending a totally garbled distress signal right to your brain. It's the perfect, everyday example of what a minor nerve injury feels like.
The best way to think about nerves is to picture them as living, biological cables. They are the body's electrical wiring. They carry all the critical messages between your brain and, well, everywhere else. They tell your muscles to move, they report back on sensations like touch and pain, and they even handle all the automatic stuff, like sweating.
So, if we're going to understand what happens when this wiring breaks, we first have to pop the hood and see how it's built. Let's take a look inside the cable.
This analogy is just perfect. A nerve is built almost exactly like a high-tech electrical wire. Right at the very center, you've got the axon. That's the copper wire, the part that actually carries the electrical signal. Wrapped around that is the myelin sheath, which is basically the plastic insulation. It keeps the signal contained and helps it travel super fast. And the whole thing is bundled in connective tissue, which is like the tough, rubbery outer casing that protects all the important stuff inside.
Okay, so keeping that image of our wire in your head, let's talk about what happens when it gets damaged. And this can range from a tiny fray in the insulation all the way to the entire cable being completely severed.
All right, so doctors classify nerve damage into three main levels. First, you have neuropraxia. This is the mildest one. This is your funny bone. The insulation gets bruised, it causes a temporary short circuit, but the wire itself is fine. It recovers completely on its own. Next up is axonotemesis. Now it's more serious. The inner wire, the axon, is actually broken. But the outer casing is still there, which is crucial because it can guide the repair. And then you have neurotemesis. This is the big one. The entire cable is sliced clean through, the connection is gone, and without surgery, there's just no way for it to heal.
But here's where the story gets really incredible. When that inner wire, the axon, gets broken, the body doesn't just throw in the towel. No, it kicks off this amazing methodical process to clear out all the damage and literally pave the way for a new nerve to grow.
This whole process is called Wallerian degeneration. It's wild. Within a day or two, the part of the nerve that got disconnected from its power source just starts to break down. Then the body's cleanup crew, these specialized cells called macrophages, moves in and tidies everything up, removing all the debris. And then, and this part is just genius, these support cells, called Schwann cells, line up and form a perfect little tunnel, a biological guide path, just waiting for a new axon to start growing right through it.
But this whole incredible process comes with one massive challenge: speed, or rather, a lack of it. Nerves regenerate at a painfully slow pace, about 1 to 3 millimeters per day. Let me put that in perspective for you. That's about an inch a month. So an injury up in your shoulder could take years for the nerve to regrow all the way down to your hand. Years!
So, given this incredibly slow repair process, how does anyone, a doctor or you, even know there's a problem to begin with? Well, thankfully, the body sends out some very clear warning signs.
First up are the sensory signs. If the wires that carry sensation get cut, you get what you'd expect: numbness, tingling, or just a total loss of feeling. And this isn't just weird, it's actually dangerous. You might not be able to feel things that could really hurt you, like a hot stove or a sharp object.
Then, of course, you've got the motor signs. When the signals that tell your muscles to contract are blocked, you get weakness or even total paralysis in those muscles. And if a muscle goes too long without getting any signals, it starts to waste away. It's the whole use it or lose it principle, in the most literal sense.
And finally, there are the more subtle, kind of weird signs, the autonomic ones. These are the signals controlling all the stuff you never think about. So, when they're damaged, you can get strange symptoms like really dry skin because you're not sweating properly, or brittle nails in that one specific area.
To see how this all comes together in the real world, just look at this classic example. If you injure the radial nerve in your arm, it cuts off the signal to the muscles that let you lift up your wrist and straighten your fingers. The result is something called wrist drop. You literally can't do it. It's a powerful, undeniable sign that a very specific wire has been cut.
Which, of course, brings us to the most important question of all. How do we fix it?
How do we help the body reconnect that broken circuit and get the power flowing again?
Well, there are two main paths. For the milder injuries, where the nerve is mostly intact, the approach is conservative. You support the body's natural healing with things like rest, maybe a splint, and physical therapy. But for the really severe injuries, especially when that wire is completely cut, the only option is surgery to physically line up the two ends of the nerve again.
And surgeons have a really sophisticated toolkit for this. They can do a neurolysis, which is carefully freeing a nerve from scar tissue that might be squeezing it. They can do a direct repair, where they meticulously stitch the ends back together under a microscope. If there's a gap, they can use a nerve graft, often taking a spare nerve from your leg to bridge it. And in some of the most advanced cases, they can even do a nerve transfer, where they reroute a nearby healthy nerve to take over the job of the damaged one.
But even with the absolute best surgery in the world, recovery is a long, slow road. So what are the factors that determine who has the best shot at a great outcome?
Well, a few key things really matter. Younger patients just tend to heal better. The type of injury is also huge. A clean, sharp cut is way easier to repair than a messy crush or stretch injury. And here's a big one. The closer the injury is to the muscle it's supposed to control, the less distance the nerve has to regrow. And of course, getting a quick, expert surgical repair, followed by really dedicated physical therapy, makes all the difference in the world.
Now, what's so exciting is that while these challenges are massive, especially that slow as molasses regeneration speed, the future of nerve repair is looking incredibly promising. There's so much new hope.
I mean, just take a look at what's on the horizon. We're developing artificial nerve conduits, basically man-made tubes to guide nerve growth so you don't even need a donor nerve. We're exploring stem cell therapies to turbocharge the body's own regenerative powers. And we're using advanced robotics to help patients regain their function faster and more effectively than ever before.
Which leaves us with this one final, fascinating question. For all of our incredible progress, we are still stuck with that fundamental biological speed limit, 1 to 3 millimeters a day. So as technology like stem cells and robotics gets even better, could we one day finally break that barrier? Could we actually outpace the body's natural speed limit and reconnect its most delicate wiring faster than ever imagined? That is the challenge and the incredible promise that scientists are working on right now.